Natural procreative technology versus IVF. Today, on The Simple Truth, we consecrate everything to the Sacred Heart of Jesus through the Immaculate Heart of Mary and the pure, strong, chaste heart of St. Joseph. I'm your host, Jim Havens, and our guest today is Dr. Teresa Hilgers, an OB-GYN at the St. Paul VI Institute. stpaulvi.com is where you can go. She's also the daughter of Dr. Thomas and Susan Hilgers, who founded the Institute. A great blessing to have Dr. Teresa Hilgers with us. Welcome to The Simple Truth. How are you today?
Great. Thank you so much for having me be a part of your show. I'm really excited to be here.
Yes, thank you so much for saying yes and being here. And let's begin by, I guess, just thinking about the average American couple today who are struggling with infertility. They go to their primary care physician or OB-GYN seeking advice. What are they commonly advised to do? How does that appointment normally go?
Well, it can really go a number of different ways. When we talk to our patients, we hear a wide range of things that can happen. Some patients are told, just keep trying. You just got to keep going. And they'll be told that for a year, 2 years, 3 years, which is, I would say, more abnormal that they would be told that, but patients are definitely told that. They'll do a few lab tests, maybe an ultrasound. They'll test the man to see, if there's any sperm present. And then they might do a few rounds of medications to help with ovulation or things like that. But it's not uncommon that they very quickly get pushed into intrauterine insemination, which is, or IVF, in vitro fertilization. Excuse me. I definitely know how to say IVF. But in vitro fertilization is very common. So those two procedures, intrauterine insemination or IUI and IVF, are couples are quickly escalated to those procedures. And when it comes to Catholic teaching, those are not allowed as possible treatments for IVF or for infertility. Excuse me.
So how does that appointment differ in terms of when a couple comes to you or someone trained in NaPro Technology? What advice do you give to couples who are struggling with infertility that come to you?
Yeah, so the way we go about it is we first take a really good history because for us, infertility is a symptom. So it's a symptom of something else. The infertility itself is not the final diagnosis. It's the body's way of saying that there is a problem. We can't become pregnant, whether it's an issue with the woman. There's a physical roadblock. Maybe her fallopian tubes are blocked. Maybe it's an issue with the husband. And it's our job to actually figure out what that is. There are many common causes of infertility, such as endometriosis, which presents in the woman as painful periods. So we get a really good, thorough history of, what do their cycles look like, pain with their periods, premenstrual symptoms, any of that. And that helps guide our evaluation process. And so then we dive in, we do a targeted evaluation process to understand what the roadblocks are for that couple. And then we try to remove them to the best of our ability to give them an improved chance at improving their fertility so that they can conceive on their own. Many times we have patients who come to us and they'll say, we have unexplained infertility. And they are actually never given a reason for why they can't get pregnant. And they were just pushed towards IUI or IVF. And it's very frustrating for patients when they don't actually have a diagnosis and an understanding of why they can't get pregnant.
Yeah, let's also define here in the beginning the nature of what NaPro is and the nature of what IVF is and what they do. What is NaPro technology? What is IVF?
Yeah, so NaPro Technology stands for Natural Procreative Technology. It's been around for over 30 years now. And what it does is it's a women's health science that basically cooperates with the women's menstrual cycles. So it relies on the woman charting her cycles with the Creighton model fertility care system. That's a standardized way of charting the women's cycles with objective biomarkers. And it's very important for the physicians because the chart, I always tell patients, the chart never lies. It tells us so many things as to what might be occurring with the patient. And then we use that in our evaluation process so that we can diagnose the patient. and then treat her in a way that supports the menstrual cycle instead of counteracts it. With in vitro fertilization, so there's different types of IVF, but simply stated, it's where the woman's ovaries are stimulated to produce many follicles that have eggs within them. The eggs are retrieved, and then the man will submit a specimen with his sperm, and they put basically the egg and the sperm together in a laboratory, and then they create embryos or babies, and then they will insert the baby into the woman at a later time and hope that transfer is successful.
So NaPro, meaning natural procreative, IVF, in vitro, which I believe means in glass, which I think the term that used to be used maybe decades ago that was maybe even more descriptive is they would say test tube babies as a way to kind of explain that this conception is occurring not only in glass, but in a dish, in a laboratory, and that kind of gets at the ethical problems here, and there are even more than just the way of the nature of the conception, but that's where it begins. But I guess anything more what would you like to speak to in terms of the ethical distinctions? Because clearly NaPro is a moral solution, nothing wrong with it. It's getting to the bottom of things and dealing with it in a completely ethical way, whereas IVF is inherently immoral. Anything further on the ethical distinctions that you'd like to point out?
Well, we could spend hours on that if we really wanted to, but I think it's actually a very important point that we do discuss this and patients and couples understand that, because in our culture today, IVF is very common. Everyone knows about IVF. Very few people actually know about NaPro Technology. Everyone believes that IVF, if you go through that, you'll get pregnant, which is actually not the case. But it's actually a very unethical form of medicine in many, many ways. And in order to be good medicine, you have to have, I think, two criteria that are met. One, that there's actually good medical science behind it, good research, so that we know that it's effective at what we're doing. But secondly, it has to have good ethical background behind it as well. If we partake in unethical medicine, we create more problems. And IVF typically creates more problems. So when we see with IVF, number one, there's a huge problem with frozen embryos. So there's an embryo storage problem in the country. So many couples who go through IVF have many babies that are created during this process. And then once they have their 1 or 2 babies through IVF, then what do they do with their maybe 4, 7, or 20 embryos that are left in storage? IVF is actually very highly abortifacient. So many babies are created and lost just to create one baby. It also creates problems with surrogacy, parentage. Women who are older in life and undergo IVF very rarely are allowed to use their own eggs. So many times they're using another woman's eggs or another embryo created from a different couple. Donor eggs or donor embryos are problematic as well. And so I don't think that a lot of people within our country and probably around the world actually understand how many problems there are with IVF ethically. But medically, it's actually not a very good treatment either. It's actually a very poor treatment for infertility in many, many ways. On the flip side, NaPro Technology is completely ethical. So believe it or not, NaPro Technology only exists because of the Catholic Church. So just a brief history. Humanae Vitae came out in 1968, which is a really important encyclical on human life. Interestingly, the first IVF baby was born 10 years to the day after Humanae Vitae was released. But Humanae Vitae is what converted my dad to this understanding that the Catholic Church's teaching on contraception and fertility was correct. And it started the process of his investigation and eventually the development of the Creighton model system. And it's through the Creighton model system that NaPro Technology developed because he wanted to have a system where couples could successfully achieve or avoid pregnancy, where they could practice building their families in line with the teachings of the Catholic Church. But what he recognized is that women came to him with infertility or recurrent miscarriage or other issues, that the charts had similar patterns to them. And he realized that the charts were telling him something that he had never seen before or anyone else, and that the charts would help us figure out these problems for these women. And so through all of this, we've actually developed evaluation protocols, treatment protocols, where we can have very high success rates for treating women's fertility so they can conceive naturally on their own. And many times these women, they may need our help for their first pregnancy, but after that, they may not need help for their second, third, or fourth pregnancy. Some women will always need assistance or support with each pregnancy, but it's amazing how many women, once you remove the roadblocks to their fertility and kind of bring that fertility back to life, then their fertility is normalized and they don't need your help ever again. With IVF, you don't see that. They always have to go back for help.
Yes, yeah, we are very blessed to have Dr. Teresa Hilgers with us today. She is with the St. Paul VI Institute. St. Paul, spell it out, SAINT, Paul, VI.com, and we got a bunch more to get to today. We are just getting started on this. So we're going to talk more about the effectiveness when we get back, along with why we don't hear more about NaPro Technology. And there's a lot here. We're going to pull that thread. But also, I want to highly recommend a book by Dr. Thomas Hilgers, The NaPro Technology Revolution, Unleashing the Power in a Woman's Cycle, which offers real solutions to the real problems of infertility, repetitive miscarriage, family planning, other women's health issues, and also lots of great resources over there at that website, stpaulvi.com. We'll be right back. Stay tuned. Hey, just a quick friendly reminder, if you're enjoying the show, make sure to like it with the thumbs up and hit subscribe if you haven't already. Thank you so much for helping this channel to grow. God bless you. And NaPro versus IVF. We have a very special guest here, Dr. Teresa Hilgers, an OB-GYN at the St. Paul VI Institute, also daughter of Dr. Thomas and Susan Hilgers, who founded the Institute, stpaulvi.com. Dr. Teresa Hilgers talking about the effectiveness and some of the history. I appreciate you laying some of that out for us. I was very pleased to be able to talk to your father, Dr. Thomas Hilgers, probably about 5, 6, 7 years ago on the show I used to do before this one called Love Will End Abortion. Did a couple interviews with him. Very much enjoyed it. I consider him to be when the book is written, at the end of all of this, when the civilization of love has truly advanced, and we've got all of these immoral practices when it comes, especially to the early stages of human life development. When that's truly recognized and protected as it ought to be, I believe there will be a book, Architects of the Culture of Life, and I think Dr. Thomas Hilgers will have a significant chapter in that book. But we're going to get to why a lot of this work has been ignored, is continuing to be ignored in our culture today. But first, anything further on the effectiveness in terms of which is more effective as a treatment for infertility? Clearly, it's NaPro technology. It's not IVF. But anything else you want to say? Because I think this is probably one of the biggest lies that is out there.
Yeah, I think it's a great thing to discuss. With NaPro Technology, everything we're trying to do is how can we make our treatments better? How can we improve our evaluation? IVF, like I mentioned earlier, there's such a false conception or notion that IVF, everyone who goes through IVF becomes pregnant. And it's actually just not true. The success rates are actually very, very low. We've done some calculations on the success rates. In 2008, for example, less than 0.5% of women who suffered from infertility had a baby from IVF. So it serves very few women, and it's not very successful. Part of the reason why is that it fails to look at what the actual underlying problems are with the infertility, what's actually causing the infertility. So a great example is actually polycystic ovarian disease. So depending on what is causing the infertility, you're going to get different pregnancy rates. But Polycystic ovarian disease is a condition that a lot of women have where they have very long cycles. They typically ovulate infrequently. They can have a lot of other problems associated with their fertility. But do you know that 60 years ago, we had better treatments for infertility for polycystic women than we do now? In the 1950s and 60s, the pregnancy rates were about 66%. That was due to a procedure called ovarian wedge resections, where a portion of the ovary was removed from these patients, and then their cycles regulated. A lot of the abnormalities with the condition improved. The biggest problem with it was that it was a surgery, and in the 1950s and 60s, that was a really big deal, and it created a lot of scar tissue, which can cause problems. Scar tissue or pelvic adhesions are where two things stick together that normally shouldn't be attached, and so they can cause pain or infertility. In the 60s, a medication was brought out called Clomid, and they got rid of the ovarian wedge resection for Clomid, and the pregnancy rates are about 30%. And then when IVF came out in the early 2000s, the pregnancy rates were about in the 20s with IVF for polycystic ovarian disease. And it hasn't gotten much better. So my dad was very frustrated with the work in polycystic ovarian disease early on when he was trying to figure out how am I going to help these women. He went back to the literature and realized that the wedge resection was one of the best treatments for polycystic ovarian disease. And he was able to reconfigure how to do the surgery so we can do it without causing the problems that it did cause. And our pregnancy rates now with polycystic ovarian disease is 60 to 80%. Because we're trying to always find what is the cause of these problems. What does a polycystic ovarian disease do to these women that's contributing to their infertility? What can we do to make it better? And it's such a successful treatment for polycystic ovarian disease. And interestingly, not just for helping them become pregnant, but for their long-term health too. So many women who go through NaPro Technology honestly feel better through the process because many times the issues causing their infertility causes them to feel poorly with their periods, have severe PMS symptoms, abnormal bleeding. And so we're correcting that along the way. And so you get two benefits, not only helping them achieve pregnancy, but helping them feel better in the process as well, which you don't get with in vitro fertilization.
Yeah. This is information that people have a right to know, that they deserve to have, especially couples who are struggling with infertility. And yet this information is largely being kept from them, even by their own doctors. Maybe their own doctors aren't aware. But I think what we can say clearly is that it does seem quite clear that the medical establishment generally is widely ignoring NaPro technology. Why do you think this is the case? I mean, if the medical establishment truly cared about women's health, wouldn't they be praising and seeking to fully implement the discovery of NaPro technology?
You would think so, but it's not the case. Women's healthcare is actually in a crisis right now, and it has been for decades. We are not really advancing the field of women's health. And I think there's several reasons for that. And one is the culture within women's healthcare. The culture currently is pushing four main pillars, and that's contraception, abortion, sterilization, and IVF. So much of the research, the publications is all, how can we make abortion more accessible? How can we make contraception more accessible? But it's not really geared towards how are we actually going to find the underlying causes to and have better treatments for polycystic ovarian disease or endometriosis or all of these conditions that cause problems for women. One of the things with NaPro technology is we require that women know how to chart their cycles. And do you know that throughout women's healthcare, so many doctors just think that that's impossible for women to do, that doesn't work, it's not effective. They are still kind of relying on the old conceptions of what the rhythm method was back in the day. What did they call it? Vatican roulette, I think. These terrible names associated with it. The other thing too is some of these treatments like IVF, they have a huge financial incentive for going through these, offering these treatments. IVF is not usually covered by insurance. It can cost thousands and thousands and thousands of dollars per cycle. And I think too that we just have kind of lost sight of really understanding what's causing women's problems. Contraception is a huge part of this, actually, because the birth control pill and hormonal contraceptives are actually treated as the treatment for every single gynecologic condition out there. And many of these gynecologic conditions are the conditions that will cause infertility later on. So we put women on the birth control pill to treat these conditions because it's the easy way. It's what we've been taught is effective. But it actually doesn't actually treat the disease process. It only manages symptoms. And so it creates worse problems down the road. And so I think there's just so many variables for why we're actually not getting to the bottom of this, why NaPro technology isn't well known. But I think really in women's healthcare, we've divided love and life. And so we no longer really look at women and these issues like we really need to. It's a very sterile environment, to be honest.
Yeah, I think there is some hope of kind of a new framework for discussion with the advent now of the Trump administration in the sense of this MAHA movement, Make America Healthy Again, and this idea of getting past a lot of the lies and deception that we've been sold through the medical establishment, get to the truth of things, deal with the underlying issues, not just the symptoms. But yet it still seems like in this area, they're not on it. They're still missing it. Any expectation, is there anyone that is likely that you have any awareness of that could get close to RFK Jr. perhaps in HHS or some way to get to this administration and help them to understand that this is another area that needs to be looked at and it needs to be changed?
Yeah, I don't know necessarily the answer to that question, but I do know that we've kind of talked about it here. Will they be looking at some of these issues within women's healthcare? Hormonal contraception is actually terrible for women. And we've been taught that, wow, if you don't have hormonal contraception, you've lost your reproductive rights, all of these things. But it's actually one of the worst medications we can put women on. And so I hope they look at it. I really, really do. There's so many negative side effects to it. It increases the risk of breast cancer, all these other things that aren't discussed at all. And so it is an area of medicine that needs to be looked at. There's just so many competing interests, I think, right now that we're very curious to see if it will be addressed or discussed. It's something we've talked about a lot here.
Yeah, very interesting. Yeah, we'll talk about this a little bit more later in the show, but yeah, I think when it comes to why NaPro technology has been ignored to this point, I think what you were saying sort of about the profit motive, I would say, seems to be where my mind goes. Follow the money, and when you look at it, you see IVF is a multi-billion-dollar global industry. With significant corporate and investor involvement. The pharmaceutical companies certainly profit very much with the methods that are being used and the chemicals that are being used to stimulate the ovaries and other things that are taking place there. So they're profiting a lot off of this. And then NaPro, certainly far less profit driven. It has its focus on diagnosing and treating infertility rather than these high cost procedures. Really, it's for patients who are seeking root cause solutions to infertility that are far more effective. So yeah, when I look at it and you follow the money, it seems to say, there's a whole lot of people that don't want that profit to go away in the way that they are profiting from this. And at the same time now, you've got this executive order that the Trump administration has put out, just last week, expanding access to in vitro fertilization is the name of this executive order, which states the following. It says basically, it basically states that many families struggle with infertility, which is true. There are many families struggling with infertility, but then it makes this false conclusion. Therefore, Americans need IVF, which is false, which is actually getting to the whole reason that we're doing this show, although we had this show planned even before this executive order. But then they say, therefore, to support American families, it is the policy of my administration to ensure reliable access to IVF including by easing unnecessary statutory or regulatory burdens to make IVF drastically more affordable. Within 90 days of the date of this order, the Assistant to the President for Domestic Policy shall submit to the President a list of policy recommendations on protecting IVF access and aggressively reducing out-of-pocket and health plan costs of IVF. So basically a way to really probably subsidize the cost of IVF. So this is crazy expensive, what's going on. And again, the profit's going to various people that continue to profit from this, instead of looking at, is this actually needed at all? And actually, when you look at the effectiveness, this is not what should be promoted. And then when you look at the morality, this absolutely should not be promoted. It should actually be made illegal. We'll get to more of it. Stay tuned. Hey, if you're looking for some help with your daily prayer, I want to offer you 3 powerful prayers to start each day. In fact, these are the 3 prayers I lead my family in as part of our morning prayer every morning. To get these 3 powerful prayers to start each day, just go to the link in the description, and I've got a great looking simple PDF page you can print out and even post it on your refrigerator like I do if you wish. I hope these prayers help you as much as they are helping me. Now back to the show. Welcome back to The Simple Truth. Jim Havens here with Dr. Teresa Hilgers, an OB-GYN at St. Paul VI Institute, stpaulvi.com. And Dr. Teresa Hilgers, you heard me share a bit from that executive order that the Trump administration, that President Trump put out last week, that he signed and put into motion, saying that within 90 days of the order, he's looking for a list of policy recommendations on protecting IVF access and aggressively reducing out-of-pocket and health plan costs of IVF. So we're in this sort of 90-day window right now. I think it's very important that pro-life leaders, that our Catholic bishops, that anybody with some influence speaks up on this matter. Dr. Teresa Hilgers, what is your message to the Trump administration?
Yeah, I think their intent is probably very good. They want to support the building of families, right? They want to support women who are suffering from infertility, those couples. It's a cross that they bear. I think, though, it just probably represents more of a lack of understanding of what in vitro fertilization really is. Again, I think it goes back to the idea that everyone thinks that if you go through IVF, you'll become pregnant. And so it's a natural solution to infertility, when it's really not a very successful treatment. And so even if you lower the cost of the treatment or help subsidize that, you're probably not going to increase the fertility rates very much by with those group of women undergoing IVF. Some women will become pregnant just because they're able to go through more cycles of IVF, but the treatment itself is very poor. In addition, when we look at IVF, it's not a pro-life technology. It's very pro-abortion. It's highly abortifacient. We lose a lot of life in order to create life. There are other problems associated with it. I had mentioned earlier embryo storage, but the other things that many do not realize is that women who undergo IVF actually tend to have higher complications with their pregnancies. They also have higher rates of preterm labor and delivery. So we're creating problems on the other side once those women become pregnant. And then we have to deal with those consequences as well. So we may lower the cost of IVF, but you're going to increase the costs with hospitalization stays, more appointments later on as well. And so when we look at it as a whole treatment in and of itself, it's actually very poor medicine. And that's not where we should be concentrating our efforts. Our efforts really need to be in the research into the underlying causes of the fertility and supporting those areas. IVF is not a long-term solution. It's just not a feasible long-term solution because of the nature of the ethics, but also the medicine itself. And I just would invite them really to kind of read and research and understand that more than anything else.
Yeah, that's very well said. And taking that, I guess, good intent that you talk about and saying if President Trump and his administration do want to deal with what we see as rising infertility rates and just dealing with the sorrow and the pain and the problem that is infertility for so many couples, if they really want to deal with this, if they have that intent, if they have that will, What would it look like if the government helped to raise awareness and increase the availability of NaPro technology?
Part of it just comes down to how infertility is managed with insurance companies, for example. Do you know that if a woman is diagnosed with infertility, most of the time, any medical care she receives for her gynecologic conditions will be denied by insurance. So there's typically a financial burden to women. It makes us sad because women with infertility have other problems that deserve to be treated as well. But those procedures will get declined if there's at all any thought that this is for infertility. So I think that would be one major step, is just actually having insurance companies support the evaluation and treatment for infertility, because that's one of the things that creates so many problems for women. Is the financial burden, whether that's IVF or any other treatment. And so it's really sad that they aren't allowed the opportunity to actually get a proper evaluation based off their insurance companies.
And if a couple is looking to learn more about NaPro technology in terms of really find somebody that can help them here, I mean, they need to find a physician trained in NaPro technology. How difficult is that? Any advice on how a couple goes about doing that?
Yeah, I think it's one of the biggest issues we actually have is, for example, IVF, those physicians are everywhere. But in order to find somebody really trained in NaPro technology, there are not as many of us. So there's a couple ways to go about it. You can contact us at the Institute. We do help facilitate couples getting to medical, what we call medical consultants who've been trained in Creighton model and NaPro technology. There's a list at fertilitycare.org as well. You can search for a Creighton model teacher and or a medical consultant there. Many times women need surgeons who are trained in surgical NaPro technology, which is a very advanced surgery that we implement in order to remove some of the roadblocks to their fertility, such as endometriosis, polycystic ovarian disease, blocked fallopian tubes, things like that. And so there's less than 30 of us in the country who do that, but many of us take patients from all around the country. I know at the Institute, we've had patients from all 50 states, and other actual countries as well that we've treated. And so in some cases, you just have to probably be willing to travel a little bit, but I think the care you will receive will be very worth it.
And what about a physician that may be listening? Maybe they find the show here and maybe it's the first time they're hearing about it. They want to be trained in NaPro technology. What is your advice to them?
Yeah, well, I would definitely encourage any physician interested in learning about NaPro technology. Just as a quick aside, this is what I practice. I've never prescribed contraception in my life. I've never performed an abortion or done IVF, anything like that. And I find this the most fulfilling way to practice medicine. Like, it has enriched my personal life in more ways than I could ever explain to anybody in a brief conversation. But we do have several courses for physicians, nurse practitioners and physician's assistants as well. And there's a course in Omaha. It's 2 weeks, one week in the fall and 1 week in the spring, where we can teach you medical NaPro technology. And then for OB-GYNs, there is a fellowship program, a 1-year training program where we really dive into advanced surgical and medical NaPro technology. And that's open to any OB-GYN who then becomes accepted to the program. I would also encourage medical students to not be afraid of entering the field of obstetrics and gynecology. One thing I see is that many Catholic medical students, for example, are very frightened of entering our field because of all the ethical issues that OB-GYNs face. And I just want to encourage them that if you feel called to become an OB-GYN, you can do it as a Catholic, and there's no reason to be afraid. We are striving to really promote and advance women's health care in a way that is respectful of the dignity of women, their marriages, and their children. And it's just a beautiful way of practicing medicine. So if there's medical students there, they can also contact us, and we have support for them as well.
And St. Paul the Sixth Institute, stpaulvi.com, spell it out, SAINT, Paul, vi.com. And on the side of things where this is being, I guess, pushed by the Trump administration, pushing IVF currently, we're hoping at the end of this 90-day period, maybe they'll hear from enough voices and they'll understand, I guess, maybe a little bit better about what's going on. They make the right decision and they don't go forward in continuing to push IVF and even subsidize it, but instead could promote NaPro technology and any other ethical sorts of fertility treatments. What else might exist? What else is out there in terms of the landscape of ethical ways to treat infertility? Is there anything else besides NaPro technology?
Well, I think NaPro Technology is probably the best source. I mean, there are other things that are being promoted out there as well, but they don't quite have the same amount of research or development behind it. So I think if you want to be the most successful, you're going to find that with NaPro Technology. We do need more research, I will say, in how diet impacts fertility. Our nutrition is very important. Some women really need adjustments to their diet to help. We need more research in understanding what particular diets and things can improve fertility. There's so much more research that needs to be done. And so just funding of that research, I think, is really important. The manpower to do that research as well. I think that's one of the things we struggle with is there's just so few of us. And so we're trying to take care of our patients, get the research done, get the word out there. And we just need more help more than anything else. But NaPro Technology is the way that we're going to be able to, I think, really solve a lot of the problems with women's healthcare, because we're actually trying to ask the questions that are causing all these issues for all these women. And if you ask the question, you're trying to find the causes, you're going to find the answers along the way.
Yes, yeah. And along those lines, since it does seem quite clear that infertility rates are rising, what is your assessment on why infertility is increasing?
There's probably two major causes. One, I think a lot of it is how we are treating our adolescent females with their gynecologic conditions. So we're putting many women on the birth control pill to treat whatever condition is, they get put on the birth control pill or some form of hormonal contraception. It could be painful periods, abnormal bleeding, and the list goes on and on. Instead of actually addressing the problem when women are teenagers, what happens is they get put on the birth control pill, which is treating their symptoms, but it's delaying the actual treatment of the underlying condition. And then what happens is that disease process is festering underneath. And so then when the woman comes off the birth control pill years later, then she now has to deal with these conditions which are causing her infertility. And it's harder when you're older. So our fertility naturally declines as we age. So I think that's one major issue. The other issue too is we've encouraged so many women to delay childbearing, and that's not the best answer. We really should be encouraging and fostering healthy marriages first. You have to be in a healthy marriage, then children. And so we really need to be fostering this idea of it's okay to have children. And you can have children in your 20s, your 30s. You don't have to wait till you're in your 40s to have children and be well established. And then probably actually a third thing is, we do have some environmental issues within our culture, within our foods and all that could be playing a role in our fertility as well. But I think really the significant rise in the use of contraception for the treatment of basically every gynecologic condition and the delaying of childbirth have really increased our risk and numbers of infertility.
Yeah, Dr. Teresa Hilgers is with us. Just amazing work at the St. Paul VI Institute that you're doing, carrying on the great legacy of your parents. Again, stpaul6.com. You've mentioned the Creighton model fertility care system a few times. This is also very important for people to know about. Anything else you want to share on that today?
Yeah, we can't do any of this without that. So funny story, when I was a fourth year medical student, I actually went through the medical training course that we teach at the Institute now, and I am now one of the teachers. And when I went to my orientation, they handed me a packet that I was also going to learn how to teach the Creighton model. And I had not signed up for that. And I was living with my parents at the time to save money during school. And so I went home, I go, Dad, like I'm in both programs. He goes, yeah, like he's like, I put you in that one. And I go, well, weren't you going to tell me? And he said, well, I put in your acceptance letter. Didn't you read it? I was like, no, actually, I didn't read it. So anyway, it's one of the best things my father ever did, because do you know the first woman I taught Creighton model to, I realized at that moment in time that I knew more about the menstrual cycle than I'd ever been taught in my medical training. And it's a beautiful way. It teaches women what their days of fertility are. They can use it to successfully achieve pregnancy, avoid pregnancy if they're married. And then for all women, it can be used for their gynecologic conditions. And it's just the most amazing tool that we have to help us, help these women who have all these medical conditions.
Yeah, we're going to be back with Dr. Teresa Hilgers in just a moment. We'll get more on that, and who knows what might come out here in the final segment. We'll see, so stay tuned for that. But also want to highly recommend that book by Dr. Thomas Hilgers. All of his books are fantastic, but this one I know gives a good summary and is very comprehensive as well. The NaPro Technology Revolution, Unleashing the Power in a Woman's Cycle. It offers real solutions to real problems of infertility and much more. We'll be right back. Stay tuned. Welcome back to The Simple Truth. Jim Havens here with Dr. Teresa Hilgers. When we left off talking about the Creighton Model Fertility Care System, this is also something that was founded by Dr. Thomas and Susan Hilgers, who founded the Institute, the St. Paul VI Institute, stpaulvi.com. I want to hear more about that in just a moment from Dr. Teresa Hilgers, but just want to set a little bit more of the framework here too, that this is another area where we are being lied to and have been lied to over many decades about what the reality is, how things really work, what these contraceptive birth control pills really do. They actually also have an abortifacient nature, and so similar to IVF, they're going against nature, but they're also killing human life. And so this is something that needs to be made clear, the immorality of these things, because they've been deceptively pushed upon the American public and widely accepted on those erroneous premises. And one case in point here, one fact of point is just that to say that, did you know that the definition of pregnancy was changed back in the 60s, 1965, by the American College of Obstetricians and Gynecologists? They redefined the definition of pregnancy from conception, which is when human life actually does begin. It's a scientific fact. Consult any embryology textbook. Life begins at conception, fertilization. But they said, but we're going to say pregnancy doesn't actually begin until implantation. So to give a little bit of room so that if the embryo is destroyed between the time that conception occurs and the time that implantation occurs, that we don't have to say that that embryo was destroyed or killed, because we can say, well, pregnancy hadn't even started yet, which doesn't make any sense. But what happened around that same time? The contraceptive abortifacient birth control pill came on the market. So they had to change the definition of pregnancy in order to try to downplay the fact that this was abortifacient by nature, that it thins out the uterine lining, and that an already present human embryo, a human being already there, we were all that size once. If conception does occur and that human being does exist, that then if they can't implant because the lining has been thinned out by this other aspect of the pill, then it just gets flushed out, and we can just ignore the whole thing and pretend like it's never even happened. But it has happened. It is happened. It continues to happen. So this is just the truth of things. It needs to be known. We need to deal with the truth here. And so it's another big area that we need to get to the bottom of. And yeah, just thanks be to God for Dr. Thomas and Susan Hilgers, and now Dr. Teresa Hilgers, who carries the work on the St. Paul VI Institute, who has just been indispensable on the cutting edge of bringing forth the way that this all ought to have been dealt with from the beginning, and giving a real alternative of how we can really respect the way everything works, respect everybody, and still deal with problems in an ethical manner. Just beautiful work. Again, want to just highly recommend their work and their website, stpaulvi.com. Dr. Teresa Hilgers, what else would you like to share with us today?
Well, I just loved what you just said, because it's something my father has talked about time and time again, how they've changed definitions, and conception is the beginning of life. That's where everything starts. So my father would be completely agreeing with you. And I do also just want to say, yes, they are my parents. But objectively speaking, every time I practice medicine and I'm using NaPro technology, I cannot tell you how many times I am amazed at what my father did and was able to figure out. And it was honestly because he cared so much about his patients. He just wanted to do things in a way that was better for them. And he also knew very firmly that the teachings of the Catholic Church needed to be followed, because by doing that, he would be able to provide the best medicine. And I think that's one really important thing through all of this, is that in medicine, we're taught that you can't have faith and practice medicine. Those two have to be separate, but actually they should go together, because I often think that, the Catholic Church's teachings actually push us to be better. They want us to hold a high standard for what our medicine should be. And then we can develop these technologies that treat all these issues that benefit Catholics, but they benefit actually women all around the world. And so, we've actually taught physicians, my dad always jokes, on every continent, you can learn how to chart your cycles with Creighton model or get NaPro technology, except for Antarctica. We don't know how to ones yet. So I think that's just really a funny side note for that.
Yeah, but it needs to be even more widespread. And I really hope that if you're hearing this show today, that you will share it with others. We need to get this information out far and wide, especially to the doctors that are out there, but really to anybody struggling with infertility, or anybody who has to deal with the reality and needing to know what the birth control pill is all about versus the Creighton model fertility care system, which is pretty much everybody. Every parent ought to know this information and be very well aware of the landscape here. Dr. Teresa Hilgers, anything further you want to share on the Creighton model or anything else, feel free. Sounds like a bit of technical difficulty there. We'll see if we can get Dr. Teresa Hilgers back with us as soon as possible. But again, the Creighton model fertility care system, this is something that everybody ought to know about. She has shared a bit with us today, even more in this book, the NaPro Technology Revolution. Again, want to highly recommend it. Unleashing the Power in a Woman's Cycle, offering real solutions to the real problems of infertility, repetitive miscarriage, family planning, other women's health issues. This is really a great comprehensive digest that really gives you a bit of everything, gives you everything that you need to know, I think, right there. I've not read through it in its entirety, but I know my wife has, and she found great value in it. Says it's highly recommended by her. And I've looked through it enough to get a basic grasp and understanding of things, as much as I need to know as a man here. But we do need to know, men, a lot about this, especially as fathers of families, making sure that that our wives have the information, that our daughters have the information. And it's just important information that everybody ought to have at least a basic grasp of, because look, I mean, this is fundamentally important to the nature of a woman and how she works, and how we ought to deal with any problems that may arise in the scope of her fertility and the scope of her cycle, and all of these aspects that are Just incredibly important, just basic aspects of human nature that need to be known and rightly handled in a good and wonderful way. Once you have all the information, you have all the work that Dr. Hilgers has done here. So just beautiful that we have this in place. I can't imagine where we would be if there was just a major gap here and we didn't have the positive solutions that we have that have come through the good work of Dr. Thomas and Susan Hilgers, now continued on by Dr. Teresa Hilgers. So I'm just incredibly grateful for it and want to hand it on the best that I can. I hope you feel the same way and you are grateful for this work and want to hand it on as well. Find ways to do so. That's why we did this show today, is just one way that we can hand this information on and make it more and more widespread, more and more known, and just normalized in our culture. This is what this is. This is how you can rightly deal with it. No IVF. No birth control pills, none of this stuff. These are actually very terrible harms. And by the way, I do want to say any child that is conceived though by IVF, still a child of equal dignity, worthy of love just as much as you and I. Once that child is there, that child is a sacred person in the image and likeness of God to be loved, regardless of how their conception occurred. And that goes for the so-called exceptions to abortion that are pushed and all of that. Once the child is there, love the child. God bless you all. Hey, just a quick friendly reminder, if you're enjoying the show, make sure to like it with the thumbs up and hit subscribe if you haven't already. Thank you so much for helping this channel to grow. God bless you.